So you were saying you were on your way over.
Oh, this is not me to sort of say something like this, but it was shocking to me, both in terms of what's happening in the culture with AI, but a father of a 17-year-old who has an anorexic daughter wrote to me and he said he looked on ChatGPT and wanted to know who was the best person in America to treat eating disorders, and my name came up. Now, granted, maybe he wrote that to 10 different people, but it was incredible.
I know that to be true because I use ChatGPT for everything. And I was, I'm on this search for a facelift, which I may not ever have. And so I asked ChatGPT who in New York could do, and I kind of described what I wanted. And these names popped up, and one of them I knew from like 25, 30 years ago. And so I called him, and he said, oh my God, I can't believe I haven't heard from you. And so we haven't seen each other. He said, what made you call? I said, you're not going to believe it, but ChatGPT.
Right.
And so I have an appointment. There you go. So I believe that is actually true, which is good that you're on there, on the list. So, eating disorders is such a heavy topic.
Yeah.
And as you know, there are so many conversations about wellness and healthy lifestyle and what kind of cream do you put on your face and what are you eating and what are you drinking and what time do you go to bed? And we're all wrapped up in what vitamins and
you and I have both the rings.
And we're measuring how much we sleep and our recovery. And yet women, especially who have such issues with self-esteem for so long, have to deal with the kind of the weight of how we look and what we're feeling about ourselves all the time. Even the most accomplished women have that, are thinking about that. And you're really fully immersed in this understanding, this very, very complicated situation. So first of all, how did you get involved in it? And I'm so glad you're here.
Oh, thank you, Norma. I'm so glad to be here. I was telling you before, you dressed me, you didn't dress me, but in my 20s and 30s, you were a big part of my life in terms of my own identity. And now coming into my 70s, and you having the joy that this decade can be a good possibility, I just love. I had a crazy story in terms of coming into the field. I was doing research to put myself through graduate school, and I was assigned to someone who I became sort of friendly with, and we ended up having a house out in the Hamptons with 12 people at that age. I was 28, 26 maybe. And in any case, we were sitting at the beach having girl talk, which is, we just ate, I feel fat. And she said, I feel fat. And she said, well, have you ever thrown up? And I'm like, what? Like I had thrown up. And this was like
when you don't have to.
Right, exactly. And she told me that there was this disorder, that there was a psychologist up in Cornell, Marlene Boskin White, who apparently was starting to see these women. This was like the late 70s, early 80s, seeing people who were throwing up. And my colleague said she had gone up to visit Marlene, and through the group that she was running, she felt like she had better control of her bulimia. And Marlene had called it bulimia, the hunger of an ox.
Oh, so was this the first time that phrase was that word was used? Stop.
Yeah, exactly.
Oh my God.
Yeah. I mean, this was like out of nowhere. So my colleagues, I don't know if you remember EST, but my colleague was involved in EST.
Of course.
Yeah. And so through EST, she said, we should do something in New York. And she asked Marlene if that was okay. Marlene said, fine. We came down, and through EST, my colleague found 5 people who were binging and throwing up. So this is so crazy. So it was before computers. So we actually wrote to the media saying that 2 psychologists are dealing with women who are throwing up. The media thought they heard pretty women throwing up. They thought we were teaching women how to throw up to lose weight. Yeah, exactly.
No.
Yeah. So we were asked to be on a cable TV show in Long Island. We were on the show, and within a minute, we went viral. Those words weren't in those days.
Yeah.
We were on 2020. We were on the Today Show.
Yeah,
We were
I can imagine.
Yeah. And so we, out of the blue, got hundreds of letters in those days, people that we knew that were renowned. And so we just started a sort of ma and pa shop here in the city. And we opened a center with 6 people on 5th Avenue and 9th Street. And we were in every media because no one knew what this was.
Yeah.
I mean, it was really crazy. Yeah.
I have to tell you, I think, as you say this, I was not aware of the fact that it was the 70s when this started. I really had no
Like late
reference
70s,
to it. Yeah.
early 80s.
But I do believe that from a fashion perspective from sort of the body images that women have in different decades. So I was just writing the intro to a podcast I just did with Twiggy.
That was exactly what I was going to say. That's when it started.
It's so,
yeah, exactly.
And so she's so great and so funny. And as I was writing it, I started by saying, after Marilyn Monroe in the 50s, the 60s created Twiggy.
Exactly.
Or Twiggy created that sort of androgynous girly girl, waif-like body that had never really been seen in fashion history before.
Exactly.
Ever before.
Yeah. And
she was discovered, and there's a great story about how that all happened.
Yeah.
But she single-handedly, and then Penelope Tree, who I also interviewed in London.
Interesting.
They sort of were the symbols for what the female form was going to look like from the, there's always the yin yang. You start with Marilyn Monroe, and then you go to Twiggy, who's skinny, boy-like. Off goes the garter belt, off goes the push-up pointy bra, and now no bra, no garter belt, Twiggy. And
that's exactly when it started.
Yeah, and I can see how that would really be very confrontational for any woman who has any curves.
Yeah.
Which is all of us. We all have curves.
Exactly.
They're going to be there sooner or later.
Right, whether we like it or not.
Whether we like it or not, and how much of it is really sometimes unpredictable. So I can see that timing was really right on point with what we were seeing in the images, even men's bodies. So if you think at the same time, Mick Jagger, let's just look at his body. He represented a lot of, even Jimi Hendrix, who was taller and bigger boned, slim, skinny, and that the Brits all kind of had that skinny kind of look. And then it just sort of traveled, especially through fashion and beauty. Everything was now influenced by this look. So I can see. So when you opened this place, what happened? I mean, who did people come voluntarily to see you, or did somebody say, "We're taking you to this place"?
It's so interesting. And first, in terms of what you're saying about the skinny body, there's some belief that this was also the time that women were really entering the workforce. and that the idea to make women smaller, tinier, less competitive, as opposed to a big, strong woman. There's some belief that that was also what was happening in Madison Avenue.
I'm not sure about that because,
As a designer.
I remember being a part of the very narrow amount of women who were in the workforce, and the positions that were available that would be competitive were
that's
so
a good point.
almost non-existent that I think it wasn't until the 80s when the shoulder pads came in and all of that feeling of power.
Yeah.
And I can be in this, but I do think a decade isn't even enough to describe how that would start to affect the way women were looking at themselves. So,
but that's interesting. And in terms of your question, if someone, we started the first center called Bulimia Treatment Associates, and it was actually the first center in the country to deal with bulimia. There was also a center at the time that was dealing with anorexia, but we started with bulimia. And so people came in voluntarily. They were desperate. They said they wanted to stop, but they couldn't. So initially, that was mostly whom we were seeing. A year into the partnership with the colleague, I didn't feel like it was a good partnership. I decided to step out. This is also crazy. Day before Christmas, we had a talk. We ended the partnership. Christmas Day, we had a 6-room suite right off of Fifth Avenue. Day of Christmas, I get a call from the landlord. The pipes had frozen. There was a hot spell. Pipes burst, and the entire roof caved in, and the center was completely ruined. Everything. And so at that point, it really was the end of that center. I asked my colleague Michelle Siegel, who was my closest friend at the time, for us to start something new. We moved to University Place, and we started what we called the Eating Disorder Treatment Center at that point. And at that point, we were seeing everything. We were seeing anorexics. We were seeing people who were afraid of food, people binging. And it's a long, crazy story because at that point, we had 22 staff members that were working with us. And it was Michelle's idea to write Surviving an Eating Disorder because every day we were getting calls from parents like, should I put the refrigerator in the backyard? Or the call that prompted Michelle to say, we have to write a book was someone was getting engaged to his girlfriend. And he was calling us from JFK or LaGuardia. He was flying out to California with the ring. He said, but my girlfriend throws up. Should I tell her I'm not going to marry her unless she stops throwing up? And we're like, oh my God, that's not going to work. But we better start telling him how to communicate. We better start writing down what families should do, what they should say, how people, if you're concerned, how to bring it up.
Yeah.
And so that was Michelle's idea. We ended up writing Surviving an Eating Disorder, and it became the first book for family, friends, because people didn't know what to do. I mean, we would get fathers who had 5'5", 90-pound daughters saying, just eat. This is crazy. Just eat. And it's so funny because we talk about ChatGPT. I actually thought, oh God, I'm going to be talking to models and designers. How do I talk about eating disorders in this field? So I looked up at ChatGPT, and actually the only thing that they reminded me to do was to make sure that I acknowledged the work you're doing, which that was easy.
I love ChatGPT. I swear I do. It's so great.
But I really thought about it because I thought, I work with people in the film industry. And I work with people who've had to gain 40 pounds for a role, lose 40 pounds. Mm-hmm. That's not an eating disorder.
Yeah.
Having to be a certain weight for your job isn't an eating disorder. Can it create disordered eating? Absolutely. Mm-hmm. Can it create an eating disorder? Sure. But the difference is that an eating disorder is a way of coping. So if someone is restricting to be a model, if they're able at other times to eat whatever they want, if they're not afraid of food, if they have other ways of coping with their feelings, if they're engaged in relationships, that may not be an eating disorder. So what's really important is how the food, how the restriction is used, and how much food noise there is. Because when I get someone who's gone from being anorexic or bulimic to recovery, and that can happen, but the first thing they'll say is, oh my God, I'm just not thinking about it. Because they would be thinking from the moment they woke up.
I think the interesting thing is back to what you said. Our relationship with food is so complicated. And, I think it's men and women, but obviously it's more women.
Although growing number of men at this stage of the game.
And boys.
Yeah, exactly.
And I think, it might reflect other issues, and maybe having more control over your body in that way.
Yeah.
But I can't, and when I was doing my book, I had a lot of conversations with women too, about their relationship with food. And I think, we all do have a complicated relationship with food. I know for me, I think about food in relationship to health, but I'm still thinking about it in a purposeful way.
Yeah.
Because I want to have more protein in my diet. I want to eat at certain times. I want, I have all of this from a health perspective, but I still have a complicated relationship with food because I'm not letting it just happen. Okay, it's time to, I'm hungry. I'll eat now. Instead, I have all of this. I'm going to have protein. This is what I'm going to have. I'm going to eat this much, maybe at 3:00, and then this much at 6:00, and then that's when I'll be,
Yeah.
And so I can tell you that that's my relationship with food, but I promise you, pretty much everybody I know, including most of the people in the company, I see what they bring to lunch and how, this is not a simple conversation. This is almost affecting everyone. It, to me, seems how complicated is it getting, or how complicated has it been? And where's that line where, you just, and can you relax a day and just not care? Can you know what I mean? So at what point would somebody then think, bulimia or being anorexic or vomiting, obviously when that determination is made, something was decided. And so at what point would you say some support, some help is needed?
That's a really good question. I think when it interferes with one's life, you're absolutely right. Like everyone, I almost feel like people's relationship with food is like a relationship with a person. Like
totally.
Exactly.
Absolutely.
It's funny. I'm somebody who hates excess in any part of my life. And I think when I was in my 20s and 30s, it was much more complicated for me. I remember not eating breakfast because I ate too much the night before. And I was my body was bigger than it is now. And the last years, it just normally got thinner. But people think I'm anorexic because of weight. But the thing that has grown, it took me a long, long time, is to really know when I'm hungry and that it's not about portions, but I know that portion will make me full. And I've sort of learned that over time. That said, every night, and I know you would never eat this way, but before I go to sleep, it's very soothing for me to have some chips. So it's like every night. And
so it's interesting, right? There's something, I know when I met Marty, he had ice cream before he went to bed every night.
My father did that.
You have got to be kidding me.
Yeah.
like, can we just get this ice cream out of the house? Never mind having it every night. I was shocked, but there's also comfort in
Yes.
food. And so how do you make sense and logic out of what is comforting, what is sort of not healthy, and what is the anorexic, bulimic
No,
kind of
it's
zone?
such a good question. I mean, the first thing I would say is, does it interfere? I mean, if it works for you to eat at certain times and that works, that's fine. But if you're not going to a dinner party because it's at 8, I've seen people do that, or that they won't go out because they're a certain weight. So one is it interfering? 2, you alluded to this, eating disorders are really when someone's not in touch with, are they hungry? Are they full? Do they know? Yeah. Are they allowed to eat when they're hungry without being scared that means that they'll be in a bigger body? And so, and that's really complicated. That takes a really, really long time. And I also say to many of my patients, and what does it mean to be human? Because to be human means we do need those times to just soothe ourselves.
Right.
And
and to kind of like, so you have ice cream or chips, but then you kind of decide the next day that you had a great Saturday, but tomorrow you're just going to go back to where you were. And so allowing yourself to have these days. But I think one of the other things that I noticed through the years is I love to work out. So I go to lots of different classes, right? And I remember being in a series of classes, and a lot of dancers were in the classes. And there were 2 girls. One was a dancer, former dancer, and there was another girl. And they would come to the class, and it's a very rigorous class. Very rigorous.
I can imagine.
And so this one girl would eat sort of a health bar, or chocolate covered, or make-believe chocolate covered, make-believe food kind of bar for energy before the class. And she would drink like a whole bunch of water. And you could see her bones and her skin. And so she was covered most of the time. Because she was so thin. And she would sometimes do 2 classes in a row.
Right.
And I thought she probably ate something.
Oh, right. Good point.
That she was hoping, she probably had something to eat and felt bad about it at a scale greater than I can imagine. But admittedly, if I ate a lot the day before and I went cuckoo, it's like, I better work out tomorrow.
But
and so I would do that too. But it's
different. It's different though, because for someone who's really in trouble with food, what would be happening the day, I mean, I've had those days where I'll go out with my daughter, we order anything. If someone does that and they're in trouble, their identity changes. I'm a terrible person. They'll tell me they feel like a blob. Because the eating becomes a way of identity. So if you can have a day like that, and then the next day say, you're in touch with your feeling too. Like after a day like that, you probably don't want to eat that much, and the exercise feels good.
Yeah.
When it starts to become, I have to, and I can't take a day off because I'm sick. I have patients who have exercised through COVID, through knee injuries, because eating disorders, where it becomes a problem is when it's an identity. I'm a good person if I eat this way, and my day is completely ruined if I eat another way. And it's also a way of coping with feelings. So I'm always asking someone, do you know whether you're hungry? Do you know whether you're full? Because that's a way of starting to know who you are inside. And I'm always wondering if what is happening inside is matching how the person is on the outside. And
yeah. So what are some of the triggers? Like, what are the triggers that that you kind of have seen through the years?
Yeah, lots of triggers. I mean, I want to say to guys, even though guys are now trying to build their bodies so much that they're getting in trouble and needing actually to go to residential treatment sometimes. But, focusing on someone's body, telling them that they have gained weight or lost weight, or families growing up where we're in the dinner table. I hear a lot that all the family talk is, did you see her? She gained weight. Oh my God, she looked terrible. Watch the language in the family or the relationship around how much bodies are talked about. And the other thing, so the triggers for sure can be something like that. Triggers can be, I've had doctors, well-intentioned doctors, say, oh, you've gained too much weight. That's the worst thing a doctor can say. I mean, at this point.
But how does a doctor communicate that if it is impacting their longevity and their and the inevitability of issues with health coming up because of eating, maybe not eating too much, but eating too much of the wrong thing?
This is so hard because I've actually never had, well, maybe sometimes I've had a doctor, mostly with men, but men can hear it more than women. Women know this. People in larger bodies know this. So the question I would say for a doctor would be to say, look, I'm concerned about the longevity of your heart. Is there a baby step you could take? Because I'm sure you're at the point. When I was premenstrual many years ago, I would feel really hungry. I sort of enjoyed those weeks because it's like, all right, I can let go those weeks. But I find myself thinking, if someone in a larger body feels that way all the time, it's so unfair to say, listen, just eat less or just eat when you're hungry because they're more hungry than someone else might be. But, I think it's responsible at this point for doctors to be talking about longevity and health and to wonder if almost to have a dialogue with the person to say, are you concerned? Where are you concerned? What's a baby step we can take? And here come in the GLP-1 medications. Because it's funny, right? And my field was going crazy, like trying to accept larger bodies. And I am, this is provocative, but I feel like you do. I do feel like there are health consequences.
Totally.
That said, there's lots of studies that that's not. People say that that's not true. I think that there's a concern about health that gets lost. So what was happening in my field is that there was a health at every size movement, and so people were trying to accept their bodies right at the time the GLP medications came on. And so the question for us is, how do we responsibly talk to our patients? Because, my job is to help someone know who they are separate from the food and weight. Yeah. That said, if someone's discomfort, either medically for sure, or even psychologically, is so bad that every day they're struggling with it, my recommendation has been, listen, go on it. See, see if it helps you figure out what portions might work for you. And I've had patients go on it for a week or two, feel better about their size, go off of it. And now they're trying to figure out, can they stay satiated at with those portions?
Yeah, I think, in the fashion industry, there's been a tremendous effort to accept all people, all body types, everything. And that's good. But I interview a lot of doctors, as you know.
I love it.
And I think the general consensus is, if your weight is not a factor in your health, you still need to watch it, because weight can be a significant factor in health and well-being, especially with diabetes. And these are these are illnesses, issues that you don't really want to have to deal with.
Yeah.
And that dealing with the body weight that's going to be the best for your heart and for your overall well-being is probably the best to attack as a goal. But I think when it comes to people who can't, and an example is, and tell me if I'm wrong, when it comes to hormones in women, I think eating is a big factor, because 1 minute we're premenstrual, next minute we're post-menopause, premenopause, postmenopause, and depending, you can eat less and still feel like you're putting on weight, or you can, so your hormones start to then play with your head on your body weight and the ups and downs of them. So sometimes you're really hungry and you eat and you don't gain weight, or then other times you eat the same amount and you gain weight. So now these other factors are coming in, and having some structure seems to be, and some knowledge about, your chemistry is also important. So from your perspective in this, dealing with eating disorders, if you were to request blood tests, or what kind of information do you think would be helpful for you with someone who is dealing with eating disorders?
This is so hard. With anorexia, we have to get the labs. And when I deal with someone who's medically unstable, they're at that low a weight, there's a very clear structure that we have. They need to be eating 3 meals a day, 2 snacks, and they need to gain a pound a week. And if they can't gain a pound a week, and it's like the stock market, it'll go up a pound, then it'll go down a pound, but then it has to go up 2 pounds. If there's not an upward trend within 3 or 4 weeks, if someone cannot do it, then the question is that do they need residential treatment? Do they need more support? What's missing in the treatment? Do they need medication? Although medication is not that helpful with anorexia. So with anorexia, it's a really clear path forward. And that's where we really involve families. If you have a teen who's anorexic, we get the families involved with the nutritionist, because the families need to know what to plate for dinner. And, it's funny because there's a team of researchers in London called the Maudsley researchers from the Maudsley Hospital. And years ago, when I first wrote the book, we were saying, just get the parents out of the picture. The kid needs to figure out themselves how to eat.
Right.
But the Maudsley researchers came in and said, this is crazy. Get the parents back in. It changed for the future editions of our book, because they know what's going on. And they're the ones that can set the limits. And so at this stage of the game, they initially what they had were families coming in. They said, okay, look, we're going to sit here with a meal. Bring in something that you think she should eat.
Yeah.
They would bring in a fat-free yogurt. And the researchers would look at the parents and say, she's going to die. Because, by the way, like 40% of anorexics die. So we're dealing with a really serious.
Yes, I was going to ask you about that. It's a serious.
It's the second most cause of death, secondary to opioids, the opioid addiction. Yeah. But in any case, so with anorexia, there's a clear-cut path of needing to get medically stable. With someone who's binging or in a bigger body or bulimic, they know the problem is information isn't going to help. So what I try to find out is when are the moments, because they all have these moments, that they're eating for comfort, or they're eating because they're angry. Or I have a patient who used to say, I'm fine all day, I eat well all day, but I come home from work and Genghis Khan is in there in a cage. And when I come home from work, Genghis Khan jumps out of the cage and goes to the refrigerator and just does whatever they want. And so the work with her was to say, all right, what part of you is Genghis Khan that wants to do what you want to do? And is there any way we can do that without it meaning you go to the refrigerator? So with someone in a larger body, the labs may help. I know it's the direction that that the whole culture is going in, but the information isn't really what helps it. It's something about helping someone take agency at a moment that they know they're doing themselves in. It's one thing to have large portions for dinner and they're hungry, but I want to focus on the moments that they're turning to food to cope with a part of themselves that they may not even know exists.
You know, one of the things that I wrote about in my book was from a perspective of eating in a healthy way, was the first thing to do to go into your cupboard, take everything out, and anything that's not on the healthy, good for you list, get rid of it. And if it's bad food, throw it out. Don't give it to somebody else because you don't want to make them sick.
Yeah, right.
And then only have those things in your house. Make that a sacred place. So if you get up in the middle of the night and have no self-control over the quality of your eating, or if you, like you had a day where you were working all day, you didn't eat, and you get home and you just want to eat anything, the choices are all good. The choices are all good. Now, from my understanding, because I had a friend for a long time who was a psychiatrist who would not deal with any eating disorders unless a medical doctor was part of that process, because he felt it was the most difficult out of any issue that he deals with. And so my thought is it like an alcoholic with food, where then if you have this house where you just have the best foods, but then they sneak in these things and hide them?
Oh my God, totally. No, I read this in your book, and you know, like I say, I think everybody has to find a way that works for them in terms of eating. When I have kids who've grown up in that house, so many of those kids have become eating disordered.
That was going to be a question too. Is this something it's all you see? That's what you,
and even with those, you can't imagine, Norma, what I see. I mean, I've had people go to garbage cans and take things out. I had a patient who would go to the apartment garbage room and get leftover pizza.
No.
So,
oh my God.
I know. And so I think because there's so many psychological factors in addition to the medical factors. If someone feels deprived, if they felt deprived in their life, they're going to feel deprived with food. And most of my patients have nothing in their house. And I've heard things like they might have some flour and they'll pour water in it and then they'll put it in the oven. So it's so complicated. And the truth is, we are not reaching, first of all, eating disorders are growing exponentially. Like from 2018 to 2022, the study that doubled.
Why?
I think social media is part of it.
I absolutely, positively believe that is, because filters have created everyone into an avatar. And if you can't look like that avatar in real life, what do you do, right? What do you do? So I can just, I can see how that would be.
I mean, I'm sure you know Jonathan Haidt's work, and anxiety and the anxious culture with kids. But, you know, he said when social media started out, it's interesting. It started a mental health epidemic in general, mostly eating disorders for girls, but depression and anxiety as well. But it's interesting. He said at first it hit girls because boys were still playing with each other. You know, they were talking to each other. They might not see the person, but they had their headphones on. Girls were just judging. And he I'm sure you know his work. He talks that kids don't play anymore. And you used to play with kids of all ages, so you learned from older kids. And, you know, now you're sitting in an isolated place talking to someone on text.
There's some data showing that the most desired career girls want, the top number one today, what career do you think that is?
Oh, the first thought I had was finance because of money, but probably model or
no. Influencer,
of course,
because that's all they look at. And
of course,
influencer who's having their picture taken in somebody's clothes can get paid for it, or so it becomes this fantasy of life, right? And there are some influencers and some really fantastic girls who've taken their lives and created businesses around their lives. And they show you how they brush their teeth in the morning, to how they comb their hair, and every outfit they wear, and every kind of workout or dinner, and photograph the food they're eating. And literally their entire day is a photograph. So if that's your goal.
Oh my God, you're right. I didn't even
think
that.
Can you imagine? And they're all pretty thin.
Yeah.
So I can imagine, even though they're photographing the food, maybe not eating all of it, because it's like having a role in a film, except the film never ends.
Right.
It just keeps going. And there's some consequence in that, I'm assuming. But they've also, are very entrepreneurial and have created these great opportunities for themselves. But I do think the burden of being the avatar, of being this perfect,
absolutely,
airbrushed, perfect body, perfect everything. But so I have a question.
Yeah.
So to me, I am a big fan of the success of the Kardashians.
Mm-hmm. Yeah.
I am fascinated by how brilliant the mother is, and what a great strategist she is, and how hardworking her daughters are, and how they've literally transformed themselves into these gorgeous, beautiful goddesses who are making billions of dollars and are the new reality.
Right.
And so now their bodies are curvy.
Yeah, right.
And so you would think, now, of course, their bodies are curvy and they have waists
tiny
that are
waists,
very small.
Right.
And so maybe there was a little help or something, and who cares, because they look amazing. But I think they have such an influence on so many women, on the way women wear their makeup, which is why they sell so much product, because everybody wants to be just like them. And yes, why not?
Right.
So now these anorexic girls, I can't believe they're not influenced by the Kardashians. And so it must be even another level of something other than social media and wanting to be perfect and all of that, because the Kardashians really betray that concept of, the perfect, whatever skinny is, for however perfect. But now they may be the new perfect. So we don't know, right?
No, it's a really good question. First of all, I don't want to tell you how many influencers I've seen in my practice over the years.
Oh, I'm sure.
One who would, she had a huge following, and every night she would go upstairs to her stash of goodies, binge and throw up, and come down and eat perfectly during the day. And she was really in trouble. But I've seen a number of influencers.
Yeah.
So, and I think it's the same with the Kardashians, in that who knows really what their lives feel like. But it's a really good question, because anorexia in particular, we don't know if it's also a genetic problem. We know that they tend to be perfectionistic. They tend to be more OCD. You get these kids at 5, and if they draw out of the lines, they get really upset. So I think there's something about being perfect and in control.
Yeah.
And so you can't get a curvy body and feel in control, I think, in their minds. And And it becomes a way of their controlling, of not wanting. Like one of the things I always think about with women in particular is, do we allow ourselves to know what we want? Like I think it was Carol Gilligan had this, was asking kids years ago. She asked 10-year-old girls, what do you think of something? And 10-year-olds would tell you what they thought
in a minute. Yeah.
Get them to 12 or 13.
No more.
It's what do I think or what do I really think?
Yeah.
You know?
Yeah.
And so I think eating disorders are a real question of wanting. So when you're talking about the Kardashians, they obviously allow themselves to want food to be in their bodies. When I'm talking with someone who's anorexic, they stop knowing what they need. They turn to the outside world to think about, what does the school want? What do my parents want? What does the scale want? And so a big part of what the work with an anorexic is, and we're not supposed to call them anorexic, someone's struggling with anorexia, because the point is they have a whole other identity. But do they know when they're hungry? Do they know when they have to go to the bathroom? I have patients who know when they have to pee, but they're so out of touch with their own needs that they don't even, when they poo, it will be in the morning after coffee. They know that is the time, and get them out of that routine, and they can't trust their body. And then of course it comes to, what do you want just in general? And then of course sexual needs. Do you even know what your body needs sexually? And
so I think, you were talking about the perfectionist and drawing within the lines. And I love that, because, so for me, I'm a total perfectionist.
It's done you well. It's done you well.
However, I know that the best things I do are when I go off the line and go outside of the line. And so I think there's a realization that somewhere along the line, when a perfectionist is only a perfectionist, they deny themselves a lot of emotion, feeling, passion, creativity. And so by denying that, they can't fulfill the purpose in this lifetime, right? They miss that opportunity. And I think there's something to relating that experience to human beings in general. I mean, there are people in my company who are perfectionists, and I just say,
just play, make a mess.
Great. Great. Yeah. But what would happen if it was wrong, if it turned out wrong? What would happen? And sometimes when things don't turn out 100% right, they may not look great, but all of a sudden you see an idea there that then makes you think in a different way. And all of a sudden this door opens. And I'm not sure how something like that could relate to people who have issues with food, which is everyone. Again, I think everyone has a potential of dealing with food in like positive to negative to, So I think it's something to think about in every part of our lives, right? When it comes to food. And so what kind of exercise could you translate that to with food and with someone who's dealing with that?
Oh my God, you hit an answer to a question you asked earlier when you said, what's a trigger? I mean, a lot of kids who are these perfectionistic kids, they get to 13, 14, their hormones are raging and feelings are messy. So they shut everything down either by binging and throwing up or by not eating. And it's interesting what they'll tell me when we get to recovery. And recovery is different for each person. But like I say, it may have to focus on the weight, or it may focus on with someone who's bulimic. All right, we want to go one night without you turning to the food, What are you feeling? Where are people? Why are you turning to food instead of people? But when they're able to not go to their symptom, to their addiction in a way, I have had kids turn to me and say, great, Judith, I'm not binging, I'm not purging, I'm not anorexic. Now I'm depressed and now I'm anxious. And I'll say, good, now you're human. Because through those feelings, one, they, just like you say, some patients have learned to create something during those times to get through. It allows for creativity. Anxiety should be your best friend, because if it doesn't get too high, it is a prompt that you have to do something, that you have to change something. So what you're saying about being human and not being a perfectionistic and allowing for what that can be, I mean, that's like a huge part of my work is how to let things be messy, and then what happens next. And also to learn that being messy can really feel bad. And how long does that take? Sometimes I have people literally time. How long did you feel depressed? How long? Was it an hour? Was it a minute? And what changed it? So that it also allows for trust that you can feel bad about things and that can change.
So, I think therapy is so good for everybody. And my belief is that sometimes probably the best use of therapy is there's a time when you just need to break through the fog, talk to somebody who listens, is not involved in your complicated world, and gives you some advice, and then you move on. So the question is, as a therapist, someone with anorexia or suffering from bulimia and the habits that go with this, it seems to me almost one of the longer kind of issues to resolve. Like, as far as time, do you give it a time limit? Do you say, these are the milestones. This is what we're going to do. These are the milestones. Let's go for it. Let's see how we do. Or how do you deal with it?
It gets to what you're saying about everyone having a complicated relationship with food, because a question I have all the time is, what's real recovery? With anorexia, there definitely is a time limit. I mean, to get someone medically stable. So if they can't make any moves forward in 3 or 4 weeks, we're talking to families, go get a bed in a residential program, because guess what? You'll probably have to wait a month before a bed opens up.
Oh my God.
Norma, I had to get a bed for a 10-year-old 2 years ago, and there wasn't anything in the country that was opening up quickly. So 10-year-olds are filling hospital beds at this point, because they're seeing in social media what's going on. So in any case, with anorexia, there's a time frame to get someone medically stable. And as long as they're moving forward, I don't care if it takes slowly, as long as there is a trajectory and that they're beginning to get more engaged in their life. Because someone who's deep in an eating disorder, that's their relationship. With bulimia, binge eating, oh my God, that's so much harder. It's again, what I want to do is to have people begin to lessen the behaviors, begin to know what they're feeling at times they're turning to it, and to be more engaged in their life. So those are sort of the milestones. But with bulimia, if someone's binging every day and purging every day, I would want to have a time frame of that. If they can't change that at all, do they need more structure, a higher level of care?
And needing medical help just because of the damage they could be doing to their bodies. I mean, that in itself is another issue. And back to my friend's case about making sure there's medical care, because every time you're stressing out your heart, or, just the acidic kind of damage.
Oh, for sure.
Doing to your esophagus.
No, I've had someone tear their esophagus and they had to be hospitalized.
It's, and, obviously in my business, I know people, and I, have people working in my company through the years, and many, it's not isolated.
Yeah.
We're having to deal with it. And sometimes it takes a toll on your heart, on your overall well-being. And that, if it's starting at 10, the ability to kind of step out of that completely takes it's a super kind of aggressive approach to changing behavior.
Yeah.
So how long? So now let's say you have a 10-year-old and you recognize that she's very involved in social media, and you see her with her friends and they're all skinny.
No, none of them eat lunch, by the way. No one eats lunch.
They're all skinny. They're all kind of wearing their hair the same way, wearing the same sneakers, wearing the same clothes, different colors, and they're all not eating. And now, as a parent, you're concerned.
Yeah.
And you don't want to believe that your 10-year-old, who is now exposed to so much more, or 12-year-old or 13-year-old. And so having to address this for a child.
Yeah, it's so hard.
And doing it while all of her friends are still in the same behavior.
Yeah.
It's like, where do you move to, Mars? Like, where do you go?
This is so hard. I have a couple kids in recovery right now, and they're the only ones who are eating lunch. And sometimes what they'll do is go to the nurse's station to eat lunch because they're too embarrassed, because they're the only ones who are coming and eating lunch. I mean, the girls are eating like a piece of salad or nothing. In terms of the families, it's so hard. I mean, you don't want to believe your kid's in trouble. And I've had so many parents say it's a phase. And what we know helps is the early intervention. And we also know what helps is a good relationship with the provider, the therapist.
Yeah.
But in a situation like that, I would, if you're worried about your kid, the first thing I would do is get a doctor in there who knows about eating disorders.
Yeah.
And because unfortunately, there's so many doctors here in New York who are part of the culture, will say she's skinny, she'll grow out of it. Meanwhile, I know that they're eating one meal a day, period.
And I think they're all doing it. If they're looking at social media, I think they're all doing it.
Well, they're all having disordered eating for sure. The question is where it locks in.
Yeah. And that's what my next question was. I think they're all experiencing that.
Yeah.
Just like in the 70s, we all were wanting to be skinny.
Totally.
And when you were talking about the 70s, I was like, what was I doing? But I was dancing every night.
Wow. Right.
And sweating a lot.
Right.
So I remember that I could eat.
Right.
And I had a job in the summer to pay for art supplies in a coffee shop in the financial district. And remember those old finger luncheonettes? Oh
yeah.
So I had the last finger.
Oh, that's so funny.
And so the pay was really minimal, but you can eat all you wanted. And I remember like piles of food and just eating and eating and eating because I could. But then, so I was dancing a lot. So I kind of got through that. And my body didn't tend to kind of pick up weight a lot. And I was very active. But I do remember thinking as I got older about my weight.
Mm-hmm.
Yeah. Mainly because I wanted to fit into my
Your
size,
clothes.
into my clothes, and then and then seeing it in the industry.
Yeah.
And seeing the models, even now, when we choose models, I choose girls who, I have one girl that's a gymnast. I have another girl. Most of them are athletic.
Yeah, you could see that they're toned.
So they're thin, but they're toned.
Yeah.
And they eat. I mean, we all have lunch together, and those girls eat.
Interesting.
So there are some agencies that have girls and some brands that use girls that are incredibly thin.
Yeah.
And they come up and they're beautiful, but my clothes are athletic and they're, it's more about a toned body.
Yeah.
And so I can't use them because that thinness, while it's good in certain parts of the industry for certain brands, and that's another thing that confuses women on what is that image that we're looking at. So now in our culture, if it's not the Kardashians, then what is the physical image that women are looking at as an example of what it should be? It's not Marilyn Monroe anymore.
I know.
It's not Twiggy anymore. Not sure if it's the Kardashians, but they have a big input. I think globally, I see them in certain countries, certain parts of the world.
For
body
the butt implants.
Just the kind of that shape. So the question is, what is the ideal?
Such a good question.
And where are we with that? So I'm wondering, from the 10-year-old to the 15 or 16-year-old, who is she looking at? And I know, like Sabrina and some of those girls, and they're not emaciated. They look great. They're curvy, and so it's
that's a good question. I think to your point, they're looking at the influencers, but it depends on which influencer. All the influencers are thin. Some of them are more toned and strong, but I think it's still thin. But that's a really good question, because what I always ask my patients, is there anyone in a body, they may have a perfectly fine body, but it's not, I want to say model skinny, I'll say, is there anyone that you admire that has that body? Is there an athlete? Is there a soccer player?
Right.
It is really hard for them to come up with somebody. So that's, I know the fashion industry is trying to expand, but
but you can't really decree something like this. You know what I mean?
Exactly.
Because it is the social media aspect of it, the pressure from the peer pressure for everyone. But I do think there's more information now about how to eat healthy and be lean, like the girls I use, they're very toned. They're so strong. I mean,
you can see they're strong
do things with their bodies, and they're really powerful. And when we work, they work hard. They're lots of outfits, moving quickly. And so I think there are examples of how to be lean, and muscular, and
powerful and toned,
and powerful. So there are a lot of good examples. And I talked about protein before. There are different ways to eat, and I'm not calling them diets, because they're not really diets. It's more of lifestyle way of eating that can really support that. And you have to eat a lot of protein to be slim and thin, a lot of it. And so it's a shocking revelation, but I think there's so much new information now that can be accessible and
no, and that's where I'll work with nutritionists too, not just the doctors. The nutritionists come in and are able to talk in this way. The doctor might say, add protein powder, but it's like, wait, how do you get this from real food?
Yeah,
so, no, I agree with you.
Yeah, I mean, real food is great. The protein, because it's very hard, actually. You're supposed to get this muscular, lean body. If you have to, for women, you should almost have as many grams as your body weight. That's a lot.
That's a lot of protein.
It's a lot of food, and I think, oh my God, am I ever going to be able to eat that much in a day? But there's something really incredible about the power you feel with muscles and
you're such a role model to me in that way.
But I think for these girls, seeing models like the girls we use and knowing that they eat lunch here, and I think, oh my God, like.
And they're not throwing up. You can tell they're not running.
Throwing up. No, they're not at all, because they eat and then they have to go back and have their hair and makeup redone, and like
it's a lot of work. Yeah. But I think actually that the word power and strength is words I use a lot with my patients. Certainly with the girls, the boys are overdoing it with power and strength, but and a lot of the people I work with are able to get healthier, come out of the disordered eating, are able to eat more because they have started to work out for the first time.
Yeah,
and it's so funny too. Though I'm thinking that you say it's so complicated, it never stops. One of my closest friends is 81 years old. And she and I are both at weights that we're comfortable with. We still talk about like, wow, we're still feeling like, why are we even talking about this?
Right. Yeah.
And that said, I think, because I'm older, obviously, I remember when my shirts shrunk, and I swear to God, for a year, I thought, what the hell's going on with my shirts? But my waist was getting wider. It took me a year to realize it's me. It's not my shirts.
Yeah.
And I had to give them all to my kids or give them away. But to say, okay, this was what reminded me of your book. It's like, okay, this is a different identity. This is a different body. What comes with it in terms of wisdom? What comes with it in terms of strength?
Yeah.
Things like that. Yeah.
I think, anorexia doesn't really have an age group. It's like there are women in our age group who are anorexic and have eating disorders, and as you get older, it's really important to maintain muscle mass. And so if you don't eat and you lose weight, you lose more muscle, and that really is not good at all. I mean, from a survival point of view, it's almost more dangerous to be anorexic or to be
for sure
having these challenges with food that are so great as you get older. So what happens? How do you deal with that?
This is going to sound stark, but if someone's been anorexic for a long time and they're at that, they die. And there's a whole controversy in our field at this point. When do you stop trying to fix them and to say, look, for those people that have been anorexic their whole life like that, we don't even know what's going on. Is it neurological? Is it, physiological? And so there's a question about just compassionate care at that point to say, we're not going to try to fix you. We're here to just make your life better in any way we can. And there are people who are guiding them to their deathbed, literally.
Yeah. Well, what about some of these drugs that deal with, that are the kind of psilocybin and all of that deal with so much, and then were stopped, and now they're starting up again, and Sarah Gottfried, who's very good, has written about this for trauma and PTSD.
I listened to your podcast.
And I think that I feel like I'm wondering if anybody's dealing with that with anorexic.
Absolutely. Oh my God. That I had an 18-year-old kid who, unfortunately, I was the family consultant, so I stopped seeing her. So I have to find out what happened. But she had been really stuck, and so she was doing, I think it was ketamine treatment, and it opened up things for her. It eased things, and at least at the point where I stopped being part of the team, she was doing better. We're hearing all sorts of, actually there's someone named Adela France who would be interesting for you to speak to at some point. She's doing a lot of work with psychedelics and eating disorders, and she'll have the whole family come in and do the psychedelics together.
I think there's something to that, because it is so deep. It's so deep that the traditional, nutritionist isn't maybe going to answer all the questions. I think there is more tools to be used, but thank you so much for coming and sharing. And so everyone, Surviving an Eating Disorder, Strategies for Friends and Family.
By the way, a Russian publisher just bought it in the midst of everything going on in Russia. It's in Russian, Korean, Italian.
Obviously, this is a global situation.
Yeah.
And I just thank you so much for this. And I think this is probably, a conversation that many people, you and I know, have had. And so I think that we touched on a number of things that might open up ideas on how to deal with this or to recognize it. But I do think some of these new drugs are a new opportunity that could be super helpful.
Yeah, absolutely. And if there's anything as a sort of takeaway, what I would say is if you go to food or you starve yourself at those moments, pay attention. If you weren't thinking about food, what else would be on your mind?
Right.
And as an opportunity to just get to know yourself better.
Yeah.
So.
Yeah.
Oh, Norma, thank you.
Thank you. Hey, press follow and leave a comment after you listen to the podcast. Thanks.